Cheriyan from MWT Education Consultancy. Today I am here with Mr. Jeril Cherian, who is Principal for Health Careers Institute. Today I am actually here for the sake of many nurses who is planning to pursue their dreams to different countries, especially Australia and the UK, that when they want to, their first and foremost fear is that they have to attend the OSCE examination. Now we hear these words OSCE a lot of time. Now we want to know what is OSCE first, and then we would like to really understand how the examination take place in a OSCE at more in UK or in Australia. And for that, the best person I thought who can answer you with all the queries you have in your mind is Mr. Jeril. Hi Jeril.
Hi.
Thank you for inviting me to this to your office first of all. Okay. So actually I am here to understand more about OSCE, as I told you in the introduction itself. Okay. Because we have a lot of nurses who is planning to aspire their career in UK, Australia, New Zealand. So now everybody is having, they want to go to UK or Australia, but when it comes to understanding the process, that is in Australia it is OBA process, that is we have this NCLEX and then OSCE. So NCLEX most of them are familiar with. But when it comes to OSCE, they do not know how this OSCE examination is. And they might have heard from their friends about OSCE in UK. And some people might have attempted twice or thrice to clear those examinations. So I am here for them to get a clarity what this OSCE is. What is OSCE? The full form of OSCE, and give me a clarity on how the examination takes place.
Okay. Thank you, Mr. Thomas Cheriyan. So as everyone heard the word OSCE, so the full form will be, it is objective, structured, clinical examination.
Okay, so first of all, it is a clinical examination.
Yes, exactly.
And it is based completely on a clinical side.
Yeah, the clinical scenarios.
Scenarios, okay, fine. That is the word, scenarios.
Yes. So here what happens is, now everyone is thorough about the knowledge side. But as each country, or I can say each hospital or institute, when they go for a standardization process, they undergo a little more scrutiny of selecting the staff.
Mm-hmm.
So in that there are different level will be there, depends upon different countries. For example, if you wanted to go to Europe or Australia or in United States, language is a must.
Okay.
And again, in certain countries, apart from language, the knowledge level is also equally important.
Okay.
So if it is USA, you have to complete that MWT simultaneously in Canada as well as in Australia.
Yeah.
And if you wanted to go to Middle East, yes, you have to complete the licensing exam of that Middle East country.
Yeah.
And so that is the knowledge part.
That is how they understand the knowledge.
But the subject knowledge.
Theory part.
The theory part. Okay. So that is one way of assessment.
And that theory part, they answer it in multiple choice questions or in different ways.
Yes,
there is online itself.
Yeah, it won't be multiple choice questions only. There are varieties of, even it can be one word question.
Okay, fine.
Or fill in the blanks and so it's 8-10 varieties of questions are there in that.
Okay, fine.
And that also depends on mainly if it's Middle East countries, it will be multiple choice.
Okay,
but other countries it varies.
Okay.
But as a general, we can say that it is MCQs.
Okay, fine.
Now, that is a knowledge part, and language is also mandatory in certain countries.
Yes.
Now, the third thing is their skill.
Okay.
How exactly? So, because if you want
nursing skills.
If you wanted to perform in the clinical side, it's not only knowledge as well as language. Along with that, they really require the clinical performance skill, and that skill is assessed in the OSCE Lab.
Okay.
Or OSCE process.
OSCE process. Okay. Now, in this OSCE process, I think it will be a lab, As I think, as you said,
Yeah, it's a simulated
it's a simulated environment, and they give you a certain scenario, and they have to present it.
Yes, exactly.
Now, how many do we have any numbers? That is, do we have any specific type of scenarios, or can it be anything?
We can roughly say it can be anything, but in that also they have certain, scenarios pertaining to this topic. There will be assessment will be there. Or assessment means the clinical situation.
I understood. Now, how will can you give me enlighten me on more about this? How the marks will be, the points they will calculate if I am given a scenario.
Yes.
Is it the performance I do, or is it based on the performance I do about the scenario, or is it something else?
It's a tricky question.
Yeah.
So one way, if I say performance wise, when we say about
why I said performance is, now those who it will be most of the nurses will be going for this OSCE, and all these nurses are experienced. They have done all these procedures one way or the other in their lifetime.
Exactly.
Isn't it?
Yes.
So is it only the performance they are looking, or is there any criteria?
Coming to it.
Yeah.
So performance, if I say, majority of the nurses who work in India, they are excellent in that.
Yeah.
And it's not only the performance they are going to assess. And I can say performance, even though you make mistakes, I am not saying mistakes, maybe minor, maybe not. Again, I am saying minor, not major. But the more importance is, rather than the procedure, how you manage that situation, your communication, how you interact with your client, and how quality-wise you are giving the care. What are the safety you are keeping for the patient, as well as the environment, as well as for the other healthcare workers where you work. So that gives the more priority.
So the scenario has all these things.
Yes,
incorporated.
And if you do the procedure perfectly, it doesn't mean that you cleared.
Okay.
And if you miss the safety parameter, for them that is the biggest concern.
Okay.
In your field. And there, the nurses from India, they make the problem. And one way, thanks for the NIBH and Joint Commission International, because majority of the hospital in Indian scenario now we have the accreditation. So to a certain extent, all the procedures are also done in a standard way.
Okay.
But on contrary to that, what happens is here the nurse-patient ratio or the workload of the nurses are quite heavy or higher compared with the international hospital. Okay. So what happens is, in certain situation, the nurses will omit the standards to the safety matters, and this becomes a habit for them.
Okay.
And what happens is, when they go in an international level, again they try to ignore this quality and safety factor, and that makes very critical area.
Okay. Now, thank you for that information. I really got. I think most of them have. For most of them, the question is answered perfectly well. Now, when it comes to this, when you say OSCE exam, we call it an exam, isn't it?
Exactly.
When we say it is an examination, everybody asks, almost everybody. It's not everybody, almost everybody. Do you give any training? Okay, do you give any? That is, they ask us, MWT Education Consultancy, do you give? And yes, I tell them, yes, of course, we do give training. When our training partner is HCI, Healthcare Residential, and we have a lab. Now, today I am here for the next part. This is the most important part. I am here to ask Jeril sir to give us a demo. Can you give us a 2-minute demo about this OSCE Lab? Can you show us the OSCE Lab?
Definitely.
And what are the different options we have?
Yes.
And so that, see, every examination needs a preparation. Sure, isn't it?
Yes.
So if we can show to our clients, or nurses, that we have a lab, how it, and I also want to know exactly what type of questions they ask. So can you show me a demo on that?
Yeah, definitely. I'll take you tour to our lab.
Thank you.
And the lab which we have created in an internationally competent way.
Yeah.
Or if you go to any part of the world, whether it is in Australia or in UK, what is the lab which is over there, exactly in the same way we have replicated.
It's the same thing.
Yes,
Okay.
we have replicated in the same way.
Okay.
And the procedure or the examination which they are assessing there, the same thing we are also making the student to practice, even though in practice we give more priority for the safety parameter.
Right.
Of course, procedure is important. I'm not saying that it is not important, but on top of that, we give more priority for what are the safety aspect which the nurses has to focus on while doing the work.
So thank you, Jeril sir, for the lovely information you have got. So now can we have a look at the OSCE Lab which we have?
Yeah, sure. We'll go for it.
Thank you.
Welcome to our lab. The OSCE lab.
Thank you. So this is your OSCE station.
Yes. So this is our first station where the students can come and they can just start the procedure. And similarly, we have one more in cubicles that is inside. I'll take you there also and give little more explanation about about the mannequin. So this is a female gender mannequin.
Okay. And this is all real. That is, we can do blood infusion, everything.
Yes.
As a real.
Now this is how, what exactly the purpose will be. If you want to be, when you are inserting an IV cannula, you can insert it over there. We have the veins which you can see it over here.
Okay.
And when you insert a cannula, usually when we insert a cannula, automatically the blood will come as a backflow.
Okay.
So similarly, when you insert a cannula, you can just see the backflow. So for that, we have created the scenarios.
Okay, right.
So it's again the full thing is we're working based on scenarios, and from the scenarios we are learning. And the OSCE concept actually it started almost in 1984. But in fact, everything with the recognition will come after long years. Now in Kerala also, the Kohas University for the examination they made OSCE as a mandatory. But our OSCE is totally highly different. It's like international.
So this is all international. This just like I'm not been to an ICU till now. So is it similar
to like an ICU, right? Yeah, exactly. So we have created all the emergency panels for the different type of the air. Like
so when I stand here, I feel that I am in an ICU, the hospital setup. So you have created everything in a hospital.
Exactly. See, we have all these are real actually. So this is suction apparatus, and this is the emergency card with oxygen cylinder. It's oxygen in it.
Okay.
You can. And so the emergency card also we have the emergency drugs, or whenever there is an emergency comes, how the nurses has to manage. And usually wherever you go in the world as a standard hospital, this is the emergency card that they are using. And how they are categorizing the instruments in this. So everything. So there are different ways, and it depends upon the equipment
So
created. And
so this is my first time that I'm seeing all this things. I've never been to a hospital, and it is all new to me, but it's really
you have a preparation desk also.
Right.
And you have the automatic external defibrillator. Actually, when we have the direct defibrillator also, because and safety is one of the biggest concerns. So we did not get it. We just created a dummy one. And we also have the side drawer as well. So and in fact we have
it's all real.
It's all real. You can have a senior board also. And suppose usually in the emergency situation, what happens is the bed is very soft. So when you give the compression, the effectiveness won't go to the chest. So we just insert the board under this and
so everything is there.
Yes, everything is there. So shall we go inside and see the
Yes, fine.
So this will be our OSCE lab, and before entering the candidate to the OSCE lab, they will come to a quiz station. So here they will get the task. Either the task will be displayed in the system, or sometimes it may be written in a piece of paper, which will be kept over
So
there.
this is what they mention as station.
Station will be inside, but this is a preliminary area where they are getting the task.
Okay, fine.
And
so after this, we will be entering into the station.
Yeah, they'll get 2 minutes time to read the task, and they have to understand the task. What exactly they are, when they go inside, they have to perform it. And after reading the task, their time starts, and in that task also it will be definitely written how much time is allocated for them, and within that time frame, they have to complete the task. And once the task is completely read, then they'll go inside. So this is how we have created the lab for us. And we can come inside.
Thank you.
And this is a typical assessment room which we have created, and even internationally also it will be same, which even we also created the bed, the mannequin, which is same like in an international lab.
So this mannequin has been imported from.
Yes, and it's not only mannequin. The other stuff over here is.
Everything is imported. Oh,
yes,
okay.
I can say including this.
This is
Yeah, the mat or the floor, everything. It's imported. So that's what we.
So what's so special about this mannequin?
Yes, where a nurse can perform all the procedure from the nursing side, whatever procedure they wanted to perform on a patient, they can do it. Like for example, from starting from head, they can instill eye drops, they can the nasal drops as a medication or the ear drops, and they can put the oropharyngeal airways, the nasopharyngeal airways. They can do a tracheostomy suction, insertion of tracheostomy tube, and once tube comes down, then you can insert a rice tube, which we used to give the food to the patient.
Okay.
Where nose, that tube is inserted, and it goes to the stomach where you can feed the patient. And
Tubular feeding.
tube, yeah, the feeding through the tube. And you can, even there are certain patients, even that may not be possible if you have some cancers or somewhere, then so we have to put a stoma,
Okay.
opening the stomach.
Okay, that is also done in this.
That also we can do it.
Okay.
And so it's not only giving, but you can
Take
put
it
back,
out.
take it back
Okay.
also.
So it's as simple as you can perform any procedure similar to a live patient or a live resident.
Exactly. Okay. Exactly.
So that is the important thing about this.
And
When we were discussing previously, you said apart from performing, there are certain factors that we emphasize on quality and
Safety. Yeah, there are a number of safety parameters which we have to look into it. I can give you just one small example.
Okay.
You can see that there is a power cord over here.
I was just about to ask you. I have only seen black cords.
Yes.
Okay.
This
But
is
here
orange color.
cord. Why is there any specialty in that?
Definitely there is a specific reason. Now orange, there are certain color which we can visualize even from longer distance.
Yeah.
Certain things which is not. Now there are times maybe possibly I'll just switch it off. Safety again.
Yeah.
Now there are certain times someone might have been pulled it out maybe just to move the cord somewhere away.
They might put it over here or something.
Either it may be here or sometimes it may be in the floor, and they might have been forgotten to take it back. And this may have this is having a battery backup. Unfortunately, because of some short circuit, maybe a current is coming back to this, and there may be power in this.
Okay.
Or let it be anything. Even if it is simply line down,
I
can
might-
just
yeah.
When you are walking, you must feel that just this may
Slow
be
down, yeah.
like a loop. So your assignment or task will be to do a procedure on the patient. But when you enter, if
I have
this
to
is
look
on
into
the
all
floor,
these factors. Okay.
Yes.
And this also will be counted in their spec sheet.
Definitely, and if you've done the procedure perfectly, but if you ignore this parameter, you're failed.
Oh, okay.
You're failed.
So
Because
all these things are. So when staff nurse enters into this room, they have to completely look at all areas,
the
all areas.
yes, wherever there is a safety threat.
So that is the safety what we are talking about.
Yes, and it is only one small parameter which I have emphasized,
Yeah,
but
really.
there are plenty of these things which a nurse has to look into in order to ensure the safety of the patient, our safety, and maybe the safety of the relatives, or maybe your colleagues,
Okay.
or maybe the safety of the structure of this particular
Entire
place,
hospital.
entire hospital. So all these things is really important. And when we teach also, we are giving more priority. Definitely we are teaching the procedure, but we give more emphasis on the safety and the quality.
Which they should not miss.
Yes. And the next thing, well, now this is a mannequin, and anyway, there is no life. But there are certain times it may be a live patient.
Okay.
It may not be. It is not a patient. It is an actor.
Okay.
They will just act like as a patient, and they also have some tasks. So they may be irritated patient or something like that. So how
We are
Yes.
behaving with the
a patient. So that
That
is also
also
some
counted.
communication part is equally important. And on the other side, there are certain times the mannequin only will be here, but still, as a nurse, you have to consult this as a patient,
And you have to communicate.
You have to communicate.
Okay.
But you'll get the reply, but not from here. Your examiner may be
Answering it.
answering from outside.
Oh, okay.
And here it will be camera, microphone, everything will be there. So they can also see exactly what you are doing it over here.
So everything is enacted.
And here also we have incorporated everything. So we have the system
Monitors.
over here, and on the other side also we have camera. Both the side we have camera, and both the side we have microphone. So whatever, either you do it from this side or from that side, both the side is equally visible, and including your audio.
So
audio.
in this OSCE Lab, which we have said, this is similarly done.
Exactly.
So it is similar to what you will find in an OSCE Lab,
Either in Australia or in UK.
So I can be very much. If I practice here many times, it will give more confidence when I work.
Definitely. It is not only that, and this is also we have enabled through internet system. The monitoring even can happen from UK live.
Okay, great. So that is where we do online visual. So we can be monitored from anywhere.
Anyway, and they can give instant feedback.
Correct.
So even we are planning to arrange international trainers. Even our trainers over here is also really work internationally.
So that we'll have trainers from Australia also to guide them.
Yeah. Yes.
Okay, great. So anything else which is more specific you would like to show me in this, or is it in the other area?
Yeah, we have the other area, and now even the bed management. So when they go to a foreign country, maybe probably those who work in the ICU or other people might have been experienced with this type of bed. But if they are not experienced, even what we are expecting is any type of movement, sort of the buttons. And this is one of the highly costly one which is used usually in the ICU.
So they can perform on this also. They can practice on this also.
Yes, certainly.
Great.
So and then you can do much other procedure like injections. You can give really the IV injection, and you get the backflow of the blood.
Okay.
You can give the muscle injection.
If I do not give the injection in a proper way, then will it give a wrong intimation?
The medication.
Yes.
There is a mannequin available, but not on this. But it costs almost 1 crore Indian rupees.
Okay.
So maybe on the later stage
We will do that. Right?
Yes.
We are expecting that.
Yes. And even the urinary catheterization. So
it's all available in this.
yeah, everything is. You can convert this mannequin to male and female.
Okay.
I mean, the gender change can be done.
Oh.
This. And it's means we try to create an ICU environment over here, including the emergency call system.
Everything
And
is
if suppose something happened immediately for the patient, and if you wanted to start the CPR, you have that emergency pull button. So within seconds, now the patient will be in flat position. But you can do it by, by the remote control, but it takes time. So you have an emergency system. So everything we have incorporated.
Similar to a hospital.
That's it.
Great. Thank you. Sir, it's really amazing. Thank you. I never expected this, and as I'm not a nurse, so for me it's really amazing. I hope it's amazing for you also. Now, there's no words for this. Now, I just want to ask, on behalf of my nurses, if they want to use this lab, or they want to come and have a training in this lab, do you have any criteria?
There is no criteria. Anyone who wants to upskill their skill, wherever country you wanted to go. Now, there are only few countries it is mandatory, but let it be. If you wanted to upskill your standards, come to us. We guarantee that your skills will be updated. It's not only just skills. Along with that, we make sure that the safety is also maintained along with that.
And what are the necessary safeties a nurse have to take care? That is what you will be emphasizing on.
Yes, it is safety of self, safety of your patient, and safety of the environment. That is the hospital safety, and the other colleagues, the healthcare professional who is working with you, their safety also. Then only you can say that you are a competent nurse.
Okay. Thank you, Jeril sir. Now, the OSCE Lab is open for you. You can come. Let it be, you might be going to UK, you might be going to Australia, you might be going to any country. Come here, have a look at this OSCE, come and do a training over here. Now, it is not necessary that you have to come and do a training to see this lab. What I suggest is, if you want to see a international lab, come here. It's open for anyone, isn't it, Jeril sir?
Definitely.
Okay,
They can come and see.
they can come and see.
Yes,
Only thing is that you have to call beforehand.
Yes.
Inform them, and Jeril sir and the team will be ready to invite you.
Definitely.
Accept you.
Most welcome. As Thomas sir mentioned, just take prior appointment before coming,
Yes.
because if the classes are going on, it may be tough to open for, general group.
Yes.
Otherwise,
It's open.
you can come.
Okay.
Definitely visit.
So, contact us. We will give you a complete live tour about an OSCE, and then you can choose whether you want to join for an OSCE class or you want to go for a UK. How simple it is going to for you to go to UK or Australia, and you don't have to worry about OSCE. We have a lab here, and you don't have to worry that you will fail in OSCE in Australia or UK, because you have a hands-on training from the expert trainers over here, isn't it?
Definitely.
Okay, thank you everyone.
Thank you
for watching this, and do subscribe our channel. Thank you, Jeril sir.
Thank you. Have a great day.
Thank you.